Hello. Anybody here? So we'll get started in just a couple more minutes. Yeah. And if folks want to join, we'll get started in just a couple more minutes. Yeah. If folks are on Mail or or Google Plus rather, they can feel free to join the actual Hangout rather than just the YouTube, and probably be a little more entertaining. You can also send questions to be asked based on the things I'm saying to my Twitter at MTK Rose, ROSE. Yeah. If folks are on Mail or Google Plus rather, they can feel free to join the actual Hangout rather than just the YouTube, and probably be a little more entertaining. You can also send questions to be asked based on the things I'm saying to my Twitter at MTK Rose, ROSE. If folks are on Mail or Google Plus rather, they can feel free to join the actual Hangout rather than just the YouTube. Probably a little more entertaining. You can also send questions to be asked based on the things I'm saying to my Twitter at MTK Rose, ROSE. If folks are on Mail or Google Plus rather, they can feel free to join the actual Hangout rather than just the YouTube. Probably a little more entertaining. You can also send questions to be asked based on the things I'm saying to my Twitter at MTK Rose, ROSE. All right, we'll get started. I want to thank everyone for bearing with us. We will refine this strategy and make it better and more interactive because that is the goal. But we will start with a federal update just to give you folks an idea of what's happening on the federal level, and then figuring out what you can be doing from the local level in response to that, and how you can be a part of the things that we are working on the federal level. So probably the first thing that I think people need to kind of keep in mind and being aware of is two rather major around the country things that are happening right now. The first is My Brother's Keeper. So you probably haven't heard a lot about this at the moment, or you've heard a little, but basically the White House has launched a big initiative trying to figure out how they can support the lives of young Black and Latino men. And while it is focused on how we can raise them up and kind of be a signature initiative, they have engaged with YBGLI about how they can make this initiative inclusive and opening to young men of color who are gay, bisexual, and same-gender loving. So what I think that you should be aware of and be kind of involved in is that this initiative has not been finished being written yet, but the White House does want to do a number of listening sessions to talk to people about how the initiative can go forward, engage, and be inclusive and meet the needs of young men who are gay, bisexual, and same gender loving. So we will probably release as the YBGLI what our comments were in the next couple weeks. But you should know that this initiative is really about doing things on a local level and engaging with folks to figure out what they need to do and who they need to partner with, which means this is an opportunity for us to really help make lives better for young folks, but also in how that policy gets implemented on our local levels. So we will probably release as the YBGLI what our comments were in the next couple weeks, but you should know that this initiative is really about, they're trying to look at areas of attract to college and career paths, access to higher education. We talked a lot about what we can do to support people to retain them in schools and keep them in schools and deal with some of the extra pressure that we as young Black gay men face, and how we can overcome, be supported, and how do we really get a lot of resiliency added into the work that we're doing. So we will probably release look out for that, and looking out will be more on how you can engage in your local levels. You should know that this initiative is really about, they're trying to second, I think everybody should take a look. We talked a lot about at, I'm going to put up on my screen now, keep them in schools and deal with some of the extra pressure this is that we as young Black gay men face, and how we can overcome. So I apologize for it being small, but this is the list of the Office of National AIDS Policy's schedule for listening sessions around the country. Now, these listening sessions will be critical in figuring out what ONAP, or the Office of National AIDS Policy, is doing, and more importantly, it's their second round of looking at what the community's response is to healthcare reform. So for those of you who are in areas where these sessions are happening in, please, please, please reach out to us. We would love to talk to you about what you can do to make sure that they are hearing the voices of young Black gay men in their discussions, and how we are making sure that they are understanding what's happening on the ground. Or the Office of National AIDS Policy is doing. So the one in Jackson actually just happened today, and we had some discussions with folks at that. South Carolina is next week. Atlanta is the 5th, which is also next week. And then Oakland and San Francisco is later. August, we see both New York and Chicago. All of these will play a key role in hearing what young Black gay men need, and how the things that the government is doing is filtering down to us on the ground, and it's actually meeting the goals of the strategy and what it's supposed to be doing. And we had some discussions with folks at that. South Carolina is next week. Atlanta is the 5th, which is also next week. And then Oakland. So, given that, I want to get into some, and these are just sessions that you should keep in mind, you should be aware of. It's a chance for you, and they really want to hear what the community has to say and be involved with. The third thing I'll talk about before kind of going to more broader questions, and we'll figure out exactly how that's going to work, because you'll have to bear with me, is looking at something I just want you guys to know about, and that is in July, HERSA. So you all remember Harold from HERSA came and talked at our summit. HERSA will be announcing who won this rather large grant for being kind of a resource and technical assistance center for programmatic support for Black gay men, and particularly looking at young Black gay men. So someone around the country somewhere is going to win this. We don't know who. However, what we can influence is who, once they have won it, how they engage with us going forward, and the kind of things that we think that it's important for a resource center to have. So really right now, let's start thinking about everything that you think you would want someone who you're going to call and get information for Black gay men around health and HIV, what kind of things you want them to be able to answer, what kind of resources you want them to be able to provide you with. And think about all of those things and just make an exhausting list. Because what we'll do is we can take that information to HERSA and explain to whoever wins this grant what they need to do to support the most impacted community and continue the good work going forward. And we've seen that HERSA is willing to be very responsive to the work and the discussions we've had with them. So it seems like this can be another great touch point for us to continue engaging with them and really get some substantive work done. So, all that being said, I want everybody to breathe, take a moment, because I just said a whole lot of things to you. I'm going to pull up a document on my screen that I would love each and every one of you to find, email, and make this your best friend. And this is a document done by some great folks at GW, including a former YBGLI chair was one of the reviewers. But it is an amazing guide looking at how do we deal with probably the biggest thing in the country right now, the Affordable Care Act, and making it work for everybody. So I'm going to attempt a screen share. And this is the document that you all want to see. This is building on the Affordable Care Act to make the health systems work for young gay men, an action plan. And while it doesn't particularly say young gay men of color, this was written with a lot of young gay men of color's input and a lot of revision and a lot of really important, smart, technical thinking went into this. And I think it's a report that everyone should keep a copy of because it's just incredibly useful for a number of policy things, initiatives, things to track. It maps some great action steps. We're actually going to go to a section today that I think is particularly important, and that's looking at what I think are some of the next steps that folks on the ground can really be doing from a national perspective that would really help build this larger framework for us all to be working on. So the guide looks at enrollment, the guide looks at medical benefits, and I really encourage you to look at that and kind of familiarize with these things, making sure that people who are still needing to get enrolled, because remember, there will be another enrollment period, and as well as talking about what we can do to make sure that people are getting all the benefits and that we are fighting cases of discrimination if we are seeing them, because there are a lot of protections built into the law to make sure that people get access to coverage and quality coverage. But I think that one of the things that the Affordable Care Act hinges upon is hearing back responses from community in several particular areas. And one of the most challenging ones that it needs to learn is, so we created all these exchange networks, we tried to make sure that people have coverage, but are people actually accessing their coverage, and are their provider networks an adequate level of quality to provide the care they need and for people to open up and talk to their providers about what's happening in their lives so that their providers can give them the best of care. And I think that this particular section is super important, and I really want to highlight some of the action steps that we see here. So identifying providers in your area network that deliver adequate care to young gay men. Find the folks who are, that you know, who are doing great work. And they're in every city. There are those people everybody talks about, that doc that never extra has time for new patients because everyone says he's such a great doc. I know in DC we all love Dr. Theo Hodge. You know, we love David Melbranch. We love Quentin Roberts down in Atlanta. But how do we build more doctors like this? And it's really about finding those people who are willing to listen to our needs, understand our community, and for us to really build on that. And so when we find these folks, we have to do our first to support their practices. But secondarily, we have to introduce them to other doctors who are friendly but don't necessarily know what they need to be doing, but are willing to listen to their colleagues. And if we can get these people in conversations with one another, we can really build networks that help us understand and engage in our health. Secondarily, it's really important to know who has HIV experience in your area. And while the HIV doctors are pretty good at finding folks, and with certain things, we splitting kind of the burden of care in this new healthcare framework, it is still important to be able to connect people with quality HIV specialists to take care of their HIV-specific needs, but also knowing that you might need a primary care doctor to do your other stuff and not overloading our HIV doctors. So it's important to figure out, where do we find these people? Who do we go to? We know that we can look at the Ryan White Bureau through HERSA. We can look at the HIV Medical Association, and the American Academy on HIV Medicine also has referral links. All these people will send you to great folks who do HIV care and can work with us. But once you find these people, we have to encourage them to figure out how, if their plans are being taken in the system, and then get the word out. So say, hey, this great doctor is taking the silver plans, he is taking the gold plans, going there. We have to ask them and populate this knowledge so that people know. Remember, access is power more than anything else. And by having knowledge and access and information, we can really bring that tipping point that brings us somewhere better. Lastly, we have to look at identifying essential community providers and figuring out what we need in our community. So how do we encourage new folks to come to our community who will provide the type of care that we need and help support the doctors we already have? We don't want to overburden the doctors we have so they can't take new patients. We want to be able to provide quality care. And in this new insurance market, with new people being able to get care, we've got to use that dollar and purchasing power to really make folks come out and enjoy. Now, I'm going to stop there and try to figure out to open this up to questions. So I'm going to open the Q&A thing, and if people have any questions, hit me up there. You can hit me up on Facebook, for those who know my Facebook, Matthew Rose, and as well as you can send questions via Twitter, and I will just wait because I know that was a whole bunch of information, And I really just want you to be able to contextualize it and think about it. So, anybody? Questions, comments, worries, concerns? And I apologize, this isn't exactly the technical solution I was looking for, but over time, I promise to make this work better. Doesn't look like y'all can interface with the level I wanted to, so this is going to be more kind of an information dump webinar, and I apologize for that. I really wanted to be able to talk with people and figure out how we can really engage with folks. So I think what I will do is I'll give it a couple more minutes to see if anyone has anything coming in, and we'll move this discussion overall to Twitter and Facebook over the next couple days, and I'll try to figure out what are the ways that we can make this more dynamic and fluid. And we'll post this video. It's going to stay, so the information will still be around for folks to access. So I want to thank everyone who's listened in to me just kind of talk about the federal government and why I think there are some amazing things to do. I'm again going to go to the top of this guide and share the page. You can Google it, look up this guide. It is amazing. It is written at a mixed technical level, but anything that you don't understand, doesn't make sense, feel free to ask any of the organizing committee for YBGLI. We are here to help, to answer your questions, and we really want to get this ball rolling and make this worthwhile for folks. Next month, just to put out there, we'll have National HIV/AIDS Testing Day, so I know a lot of folks will be working on that. The last Thursday of the month will be the second policy Google Hangout. I will try to figure out how to get more folks on air and get more people in questions and figuring this information out, because I really, like I said, I want to be able to discuss. So feel free to ask me questions then. Feel to ask me questions in the interim. My email is M as in Matthew, King, K-I-N-G, Rose, R-O-S-E, like the flower, @gmail. It's on a bunch of contact information that you already have if you've been at either of our summits. And just please, please, please reach out. I would love to have next month's discussion talking to some of the folks in the South about what they need. And the goal is to actually move around the country as we need to just figure out kind of what questions folks have about policy items they're working on, what we can do together to workshop solutions. We'll probably bring in some of the other big, great policy black gay minds that we have out there. We've got some great folks in the field, and really figuring out what policy is and how we use it to our advantage, because there are a lot of amazing tools in place right now, and it's just a matter of figuring out how do we utilize them, how do we negotiate them, and how do we best leverage them to get us the things we want and to make the changes that we want to see in our lives and the lives of the people we know. So thank you again for joining this first policy hangout. There will be, I promise, more people either on air directly with me or more chances for people to engage. I am still working out the kinks, but I am so glad that this is happening and that this lives on. I want to put a special shout out to Anthony Roberts Jr., who is our communications person and our current vice chair at YBGLI, who makes all the tech things happen and teaches me things about like how to make this work. So everyone have a good evening wherever you're at. Keep up the good fight. Remember, you are loved and doing amazing work, and you talented gentlemen will truly help change the face of this epidemic and the face of our country. Have a good one.